like to get us started. I'm Dr. Frank Apgar. I'm pleased to be able to moderate this first session this afternoon. I know some of you have heard a couple of comments already. There's been two talks, a little bit about Agile. Chris Cruz did a workshop earlier this morning talking about it. At the luncheon keynote address, it was touched on. We're going to be going into how it's actually working out in a collaborative effort between Xerox and DHCS and replacing the existing MMIS system for Medi-Cal. I can tell you that when we started out with this project, Xerox works as the FI with Medi-Cal, and we were hired in part to replace the existing MMIS system through a directive from CMS with all of the Medicaid agencies. I was able to sit in on some of the early sessions with our first approach in seeing what Xerox and DHCS was doing, and we were digging into trying to document all of the existing business processes that the DHCS staff are using to make sure we got everything built into the system that needed to be. Once we got going and then started designing the system, we discovered, both parties, that we were redesigning exactly what the old tool was doing. That wasn't what we were hired to do. So we stepped back with the CA-MMIS individuals and retooled and developed a new technique that we're finding is really helping to transform the way DHCS is working and with Health Enterprise replacement tool. We have two great speakers today that I'd like to introduce you to. Nilay Patel is the Vice President of IT at Xerox Business Services. He's been assigned to the Medi-Cal account here in California for about close to the last year or so, almost. And Peter Kelly, who's a certified project management professional, who's been chief of the MMIS project management office at DHCS. So I'm going to turn the floor over to them and hopefully have a little time for question and answers at the end.
If I can do that without not falling over. Thanks, Dr. Apgar. I see a couple people looking at their notes. This is, in fact, breaking out of a rut. We had a placeholder name. This is rebranding from another slide deck. So you're in the right place if you're here for breaking out of a rut. We had some technical challenges. Let's see if we can make this work. Can you hear me now? No. There we go. How about that? Okay. I don't know if that's applause worthy, but okay. So I've been with the project now for 10 months. We've got a number of project members here. Our leadership, Vicki Sadie. Vicki, if you could raise your hand. And next to her, the replacement project manager, Latrenda Easton. These are the two people that are doing and leading the work. I'm supporting them. I'm the one that's helping push them in the right direction to make sure that we break out of the rut, that we think of new ideas, that we do things new ways, but they're the ones that are actually leading the work, them and Nilay and his team with Xerox. And we have a huge team, hundreds and hundreds of people working on this. What's interesting about this effort for us is it's both a project and it's operating the Medicaid system for the state of California, the fee-for-service Medicaid system for the state of California, all in one. So we're a little bit different than some projects where they just go and they do the project work, they implement something, they kind of leave. We're building the future for ourselves. So we're, as someone has said, replacing the wings on the Boeing 777 Dreamliner while it's flying across the Atlantic Ocean. And that's a really tough challenge. So our goal is to modernize the way that we do Medicaid management for the state of California. Karen Johnson, our Chief Deputy Director, constantly reminds us, do not pave over the cow path, right? And what she means by that is, just because you're doing it that way today doesn't mean that you should modernize and make it more slick the exact same way in the future. Ask yourself the question, is this the right way to service the customer, the provider, the beneficiary? Is this the right way to innovate? We know that government is perfectly designed to efficiently do exactly what it does today. And if that's our goal, then we're going to hit that out of the ballpark. But that shouldn't be our goal. Our goal should be to think about, is this the right way to service our customers? And if it's not, how do we make it better? So we have to think outside the box. We've got to blow it up. We have been doing projects in the state of California for decades. We know how to fail at doing projects in the state of California. We know how to succeed too, but we fail as often as not. Big projects are really hard, and this one is no exception. So our goals in doing this project are to make sure that we provide better quality to our beneficiaries, to our providers, that we have new innovative ways of servicing them, and that our customers inside of DHCS get business value as early as possible in the process. When we look at a lot of big projects, what we see is you spend years and years and years and years sometimes, and then you do a huge implementation at the very end. And I'm sure you probably end up getting what you asked for. The problem is what you asked for might have been 3 or 4 or 10 years ago, and it may no longer be what you need. So we have to keep that in mind, because if we achieve what we asked for when we wrote this RFP back in 2006, 7, 8, awarded it in 2009, started in 10, healthcare delivery has changed tremendously. It looks nothing today like it did when we started this effort. The Affordable Care Act didn't exist. We have already changed the way that we deliver healthcare in the state of California to our Medi-Cal beneficiaries, and we will continue to evolve that while the project goes. And we cannot draw a stake in the ground in 2009 and say, success for this project is 2009. Success for this project will be whatever the state of healthcare delivery and Medicaid delivery looks like when we finish, and it will continue to evolve after that. Just so that people understand kind of the magnitude of this, the Medicaid fee-for-service system has paid over $70 billion with a B since October of 2011 when Xerox successfully took over the system from the previous vendor. We pay out almost $400 million a week in claims to beneficiaries. That's the size of our project. We spend the size of our project helping people get medical care every week. So that really puts it in perspective. Yes, it's a very expensive project. I think we're the 4th or the 5th or the 6th largest in the state. But we spend that through the system, processing claims, making payments every single week. It's a drop in the bucket when you compare it to what we're doing for the large portion of California that receives Medicaid. In the last year alone, we have reduced paper claims, I think, down to about 5% of our processing. It was close to 15, 20% a year ago. So we have continued to transform the existing system to make it better. But we have to continue with the replacement system because we make over 1,500 system changes every year based upon policy and legislative changes, change in the way that we deliver healthcare, the needs, the new programs we put together. The system looks nothing today like it did when it was envisioned decades ago. And the challenge with that is it's based upon technology that is decades old and is not easy to change. So the cost associated with maintaining the system continues to increase, while the rate at which we change the system continues to increase. So we need technology that supports the fact that healthcare continues to change constantly. With that, I'd like to introduce Nilay to come up and talk a little bit about what the FI does for us, and then we'll continue to go into the rest of the project.
Thank you, Peter. So as we get a sense for the magnitude and volume of what this program entails, let's focus a little bit about some of the key responsibilities to administer this program. Claims adjudication, that's really the heart and critical foundation to what we have to do here. We have to process the provider's claims that are servicing our beneficiaries in a timely fashion. As Peter mentioned, one of the really interesting and impressive statistics is we saw all of that data on the previous slide. 95% of that claim data that comes to us is submitted electronically. That's a very impressive number, especially factoring in the volume of data that comes to us. We have over 130,000 providers enrolled in the Medicaid program with us that service over 11.5 million beneficiaries, the largest Medicaid program in the country. Customer service is another key responsibility as part of program administration. With that, we have a dedicated call center that supports 11 different languages and supports the provider and beneficiary community. The Provider Relations Organization, they focus on provider outreach, provider communication, education, training. This is a very important organization, as Peter alluded to. All of the evolving healthcare changes that are in front of us. This group is tasked with working with these providers to ensure consistent and seamless interaction with the program and with the system. Turning to the system, from an infrastructure standpoint, system hosting, system maintenance, application support are obviously some of our key responsibilities. Some other key responsibilities, we have fraud and abuse detection and prevention, as well as cost containment. As we work towards our objective to implement a new system, we have 5 major releases in front of us over a period of time that will incrementally deliver business value and functionality. This is a shift from where we were previously, both from a methodology perspective, both from an implementation approach perspective. Methodology was previously Waterfall, as it has traditionally and historically been within state projects. Implementation approach was system-centric, a big bang approach to delivery. What this release roadmap shows you is a focus on understanding the business needs, the business priorities, and the business value. And so as we look at that and then tightly align that to the functional and the technical implementation, incremental implementation of that business value and business functions throughout the releases. One of the fundamental themes that we'll continue to enforce throughout this discussion is incremental. I'll spend a little bit of time just talking about these releases, and it's all towards an incremental implementation of business value towards our end objective. We start with Release 1, and we successfully delivered that at the end of last year. Release 1 was very important to us because it was a heavy emphasis on infrastructure, on architecture, but more importantly, laying the foundation down of the entire system, having it stabilized in production to support the subsequent releases that are coming down, that are in front of us and upcoming. Release 2, we have the ability to process claims for the first time in the new system for the department. The department has several different types of claim programs, and again, driven by the business priority, the business value. You'll see reference to CHDP, it's Children's Health and Disability Prevention Program. Business value, business driven, that was the reason why we picked CHDP to be the first claims program to implement in the new system. What this allows us to do, again, is deviate from a big bang approach from a claims processing perspective, deliver that value earlier to the department, but also allows us to learn from any lessons that we may have experienced through challenges or issues by implementing some of these things, and then applying that to the subsequent releases so that we approve on that process. The concept is the same for releases 3, 4, and 5, all business-driven, business priorities, and that's the focus for that. The one piece that I want to stress here as we laid this out when we shifted from our previous approach, a lot of strategic thought and planning between us and the department went into this to, number one, understand and identify those business priorities, those business values, and the business needs, and then tightly aligning that to that functional and technical implementation of the system. The end result is what we see in front of us here. So what is Agile? Agile is time-boxed, iterative approach to software delivery that incrementally delivers software starting at the beginning of the project, as opposed to Waterfall, where we're trying to deliver it all at once near the end. There's some key emphasis and focuses around Agile. The individuals, the teams, the interactions, the collaboration. One of the neat things that I think that we've been experiencing over the last year since we've transitioned is seeing how the teams have come together and work in this truly collaborative manner. Sprint processing, you have several teams working towards a common objective and their own objectives, but they're all working together. The interactions are extremely critical. The exchange of information that is able to occur very readily to resolve any issues or clear any obstacles or provide clarity on a requirement, for example. That is a fundamental and a key principle to Agile. The customer collaboration is tightly interwoven with the individuals and the interaction. The customers, DHCS is part of every team. and part of it in every single way, not just from an end standpoint to look at the end product, but with us all the way through, and that collaboration is critical to success. Working software over documentation, so not to minimize documentation, but to put more emphasis on working software. We have the ability to deliver working software much sooner rather than later with our methodology and implementation approach, and this is it affords a tremendous amount of opportunity. Number one, you're able to touch, feel, see, get the visibility and insight into that working software much sooner as opposed to later. It allows us to address any issues with that working software much sooner as opposed to accumulating the amount of rework that could occur towards the end. It also allows us to respond to change. As I just talked about, if there are issues or maybe the working software doesn't exactly meet the stated requirement, we get the earlier visibility into that. We're able to quicker respond to the change and correct that and continue to proceed forward. Let's talk a little bit about the Agile Scrum framework. So there'll be some new terms here for some of you. Maybe I'll do my best to step through and provide some definitions. But as we talked about, it starts with the identification of the business needs, the business value, the business priority. The inputs are all collected from various levels, executives, teams, customers, end users. That all funnels into product owners. Product owners are ultimately accountable for that particular business function. They are accountable for setting the priority and identifying the features that are part of that business function that need to be addressed as part of the project work. That list of priorities, feature sets, forms the product backlog. As the sprint process occurs, the sprint teams come together, review the product backlog with that prioritized list of features and stories, and select that work for their upcoming sprint. It's based on the respective team's composition, makeup, and size in terms of what they will commit to. But at the beginning of each sprint, they will go through that product backlog and commit to that body of work that they're going to work through for that particular sprint. Sprint process occurs, depending on the project, you can have anywhere from a 1 week to a 4 week, maybe even in larger sprints. For us here on CA-MMIS, we've got 4 week sprints. We feel that that's the appropriate size just based on the complexity and the nature of the work that we have in front of us. The key thing to note here, the end dates for the sprints don't change. The deliverables don't change for any given sprint. So at the end of a 4 week period, that's it. That sprint is over. Whatever work was committed at the beginning of that sprint gets assessed and reviewed to see how much did we accomplish for that particular sprint. Throughout the sprint process, there's daily and multiple times a day, but at minimum, daily Scrum meetings. We have a Scrum Master. Scrum Master's job is to clear any obstacles for the teams, ensure that the teams are working to their committed task list, and the daily Scrums, it's typically a 15-minute, 30-minute max meeting amongst all the teams where they review what they previously accomplished, what their upcoming workload is, and any obstacles that are in front of them. And as I mentioned, the obstacles that surface, that's the Scrum Master's job to take those and resolve those and really protect and shield the team from any outside interference so that they're heads down and focused on that work that they committed to. The end of the sprint leads to finished work products, PSIs, potential shippable increments of working software, where we're able to demonstrate to the customer and receive sign-off as appropriate for the working software. Sprint reviews are a critical component. This is where we assess the work that we committed to at the beginning of the sprint and measure our progress at the end of the sprint to see how far how far we've come on that. Sprint retrospectives, I think one of the most important things as part of the sprint process. At the end of every sprint, the teams identify what worked well, what didn't work well. And the key thing with this is what didn't work well, and even what did work well, gets implemented in the subsequent sprints. So it's a process of continuous improvement that lends itself to.
So we're going to hand off a couple times here. When Nilay showed this slide and we looked at the right-hand side, I heard a couple of gasps. And I hear this whenever we talk about this, because what we're saying is that we value in Agile certain things above other things, not that we don't value all things here. So the state of California is very good at valuing processes and tools, comprehensive documentation, contracts, and following plans. And those are all really important things, but we find in Agile that they are not the most important things that contribute to success. Thinking outside the box, recognizing that your contract, like ours, wasn't designed with Agile in mind. We have to do something different to make this work. We have a firm fixed price contract. It creates some challenges. It was designed with a waterfall methodology in mind. It has certain deliverables, and it doesn't work in Agile. We have to change it. So we are working with Xerox. We're partnering with them. We're working with our contracts folks, and we are amending the contract to respect the firm fixed price, respect the risk that has been shared between the two parties, respect the compensation and consideration, but recognize that these deliverables that were big waterfall deliverables now are small incremental deliverables that take place. And we can look at payment rather than from a systems perspective as a business value delivery perspective. So the dollars don't change, and the work doesn't change, but the way in which we exchange them changes. So when we looked at the Agile Manifesto, and you can go out and Google Agile Manifesto and take a look at it. This was written in 2000, about the same time that I started as a programmer professionally. A number of industry leaders looked at what we had been doing, starting from MilSpec and DoD and coming forward into IEEE specifications and what has become the basis for modern waterfall, and said, this drives behaviors that we don't like. How do we change those behaviors? And so we've taken from the manifesto some things that are important to us and crafted them to be CA-MMIS specific. And so we've talked about delivering business value early and continuously. One of the things that we have problems with potentially in waterfall projects is you could be 90% of the way through the project. You could have paid 90% of the contract value and not have a piece of working software. You could have a pile of paperwork this high. And that doesn't achieve our goals. So rather, we want working software that lines up with business value. And we'll take it in small increments, and we'll pay for it in small increments. And we'll make sure that as we get it, it works and it meets our needs, and we're able to use it. And that's really important, that we have to work together. A requirement specification document is not an analog for understanding what the customer needs. It's a point in time. It's an artificial construct that we create in order to manage a contract and manage risk. But the reality is, managing risk, while important, doesn't get you the outcome that you need if what you're managing is the wrong thing. So when we talk about a user story, and we talk about people getting together and having conversations, they may say, you know what, this is what we asked for in the contract, but you know, we didn't know what we were asking for. It's changed, it's different. This is what we need today. And we have a very robust change control process that we have continued to evolve over years, and just this last year had to work through it a lot to make sure it supports Agile, to deal with that as an outcome. We don't want to stop the team moving forward with getting the product done, but we make a commitment to each other that we'll do the right thing. And if we owe Xerox additional money, we'll pay them. And if they have to under-deliver on someplace because we no longer need it, we'll have a conversation about what else can we get instead. I mean, it's important to have that collaboration. And we have to get together face-to-face, right? I think organizational experts tell us that when we communicate over the telephone, that we lose like 70% of the communication intent because we can't see the facial interactions. We have that same problem. We get our folks together, we talk. Someone can say yes and be like that, and that doesn't mean yes. That means, fine, I'll go along with it, but it's not what I really want. And you can see that, so then we can ask probing questions. Okay, you're saying yes, but I'm not reading yes. What's really going on here, right? And the product owner, who is a member of our DHCS program team, or a product owner agent who is acting on behalf of them when they're not available, is able to represent our perspective, Xerox brings technical folks to the table that are representing their team, and they work together with the developers and the testers and the analysts to make sure that they are quickly and accurately communicating on what they need. And finally, one of the things that we see on large projects is burnout, right? We continue to spend time and we throw good time after bad. We get close to deadlines and we work more and more hours. Agile fundamentally says you have to build a sustainable development model. It doesn't mean you're not going to have crazy sprints when you're trying to pull something in because you've got a tight deadline, but it tries to get away from that. It does that by using data to make decisions about what we can do in the next sprint. So Nilay talked about the team commits to work. Well, the way they commit to work is they looked at their ability to deliver previous work. So if over the last 3 sprints, they're able to deliver 300 units of work, we call them story points. They're artificial constructs. If they can deliver 300 units of work each sprint, then the next sprint, they're going to commit to like 310. They're always going to stretch a little bit, but they're not going to commit to 400 because they can't deliver it. So they're going to pick what they can do, and they're going to demonstrate that over time they're going to stabilize, and they're going to continue to get slight incremental growth as their Scrum Masters get better, as the teams gel, as they cross-train. But we're not expecting to see huge changes, and we're expecting that they commit to what they can do, and because we're going to ask them to keep doing this month after month after month, and for us year after year. And then he talked about the retrospective, and we'll talk about that here on the next slide. This is so important. Having worked on so many IT projects in my career, really good IT shops will take a look at lessons learned at the end of a phase of a project. Bad IT projects look at it at the end, right? They look back and they say, well, what did we do right and what did we do wrong? And they do this lessons learned process and they document it and they put it on the shelf. And if they're lucky, somebody else looks at it. What we do is we look at an entire software development lifecycle in 30 days. So in a 30-day sprint, the team is going to do design, analysis work, they're going to write code, they're going to test that, and they're going to get it potentially shippable. They may not put it into production, but it may go into continuous integration testing and be part of the core product. So because they go through an entire lifecycle in 30 days, and they're going to do that 23 more times or more, they have the opportunity every single month to look at their own lessons learned and lessons learned from other teams on the same project and improve. Now, when we started, the list was really long. And it's getting a little bit shorter because you can't take it on all of it every month and make improvements. But you can take a couple of things every month and say, you know what, we didn't do this so well, or we had problems because of, and we're going to make a conscientious change this next month to fix this problem. And what you get is you get a organization that is committed to continuous improvement, and as time goes on, you get better. Someone else may learn from you, but you're learning from yourself, and that's so important to make this work. I stole this from Mark Layton, who, if you Google Mr. Agile, I think he wrote the Agile for Dummies book. He's come in and trained us, and I reused it for this presentation. We talk about the same things in Agile that we do in Waterfall, but we turn them upside down. Nilay said, at the end of a sprint, the work's done. You don't get a 31st day in a 30-day sprint. You get 30 days. So we joke when we say, we will never be late, because we're never going to be late. What's going to happen is we may not deliver all of the things that we thought we would deliver. So we're no longer taking a requirement specification document that is months or years or decades old and then managing against resources and time. We're managing a fixed set of resources and time, 30-day sprints, teams of 5 to 7 on average, and we're committing to 30 days worth of features, and we're building against that. And we are recognizing that scope creep isn't a bad word when it's managed appropriately. Business needs change. If we're going to be IT stewards of our business customers, we have to recognize that business needs change, and therefore scope may change. Things that we thought were important before may no longer be important. Things that we didn't even know existed may become new legislative mandates, and we have to account for them. And so what we do is we build a feature roadmap of the entire project, and we break down what is our architectural goals, what are our business implementation goals. We put them on the wall. We have a table downstairs. You can come by and take a look at it. It's about yay big. and it talks about all 5 releases and what we believe we're going to be doing in each of them going forward. But we are open to change. When a business customer comes to us and says, I need this because we're no longer in compliance with the CMS mandate, I think as was the case with CHDP, we said, okay, great, we'll put CHDP earlier because we can fix that problem, we can become in compliance with CMS requirements, we can get an early win. That's a win for everybody. It's not what our plan originally said we were going to do, but it's how we adapted and how we're now delivering and making sure that we get those functions into production and deliver business value. We're not the only Agile project in the state of California. We're not the only Agile project in DHCS. There are others, Short Doyle. There were a couple of migration projects of Medi-Cal and non-Medi-Cal systems, and CalHERS. The Health Benefit Exchange has used Agile successfully, as has healthcare.gov. When asked at a recent event, should we do what you're doing? My answer is no. You shouldn't start on a $460 million project with Agile. You should start small. But we had some problems, and we weren't able to make progress, and we had to really blow up the box, okay? The state can do Agile. We have constraints, and we'll talk about those a little bit later, that make it difficult, but the state can do Agile. This is me today, this is me yesterday. I've been having some personal challenges at work. Sometimes it feels like the deck is stacked. Again, I talked about we have a process in place in the state that's perfectly designed to achieve the results we get today. We need different results. We have to break through walls and through barriers and work with our partners and our control agencies and work with our vendors and work with procurement and work with a bunch of people to achieve this change. I don't know if anyone recognizes this picture in the background, if you've ever seen Tough Mudder, the crazy weekend warriors that go and do things. This is called Everest. Everest is a 20-foot tall quarter pipe made out of plywood, and the people that run this event think that it's funny to grease it down with oil and then have you run up it and see if you can get to the top. I have a rotator cuff that now has to be operated on because of Everest. But this was a really cool team building event. Change is hard. Right? Anything worth doing is probably difficult. It requires the organization to change. Vicki has led us through this change. She has dedicated the resources to bring training and organizational change. We have Unleashing Leaders, they have a booth downstairs as well, that have helped us through this change. We continue to work on the change. We've trained about 40 or 50 Scrum Masters. We've worked with our control agencies. We've worked with our partners downtown in the department, and we will continue to teach them about this change in process. We will continue to commit to organizational change. You have to have people with the right skills too. We have people that have been trained to work on the legacy system. That is what they know. That is their expertise. We need to get them the right skills to work on the new system. We need to teach them about Agile. We need to teach them about object-oriented system design and development. We need to teach them about business intelligence solutions, and we've committed to doing that. We're going through a transformation internally to the division to make sure that we get the right people that we currently have doing the right job in the future to support the new system, and make sure that we know how to get them from here to there and make them successful. And you don't get that without management support. You certainly don't get that without communication. Communication has been something that we have focused on a lot over the last 10 months, making sure that our staff know what's taking place, that they know who to go to ask questions, that their voice can be heard through this process, and if they have concerns, they know how to get them raised so that other people can chime in too. And this is embodied in our core values, and we use this to make decisions on a daily basis. Our management team meets 3-4 mornings a week, every morning, to talk about what's right in front of us, what decisions have to be made to make sure that the teams aren't left standing there needing decisions that they can't get because we're not fast enough, we're not nimble enough, we're not agile enough. We have to make those commitments. All of that being said, we work in California government, and we want legal protection. Our system is designed to protect the state from liability. Our system is also designed to have a bureaucracy involved in the way we make decisions. There's an excellent presentation called The Computer Hole in the Wall. It's a TED Talk. I suggest you go take a peek at it. It's about 15 minutes long. Our entire bureaucracy was designed in the Victorian period to have a mechanism by which human computers process information and make decisions. We heard the keynote speaker at lunch today talk about having to shift the way that we think about digital innovation. We also have to shift the way that we make decisions. We have to be nimble. You cannot take 2 months to make a decision when you need it in 2 days. So our existing process allows for long-term decision making. Agile does not. We have to make that change. We have oversight. Private sector does not have the same sort of oversight that we do. We have to answer to everyone. That's fine. Agile is a risk transparency methodology. It's designed to expose exactly what you're doing. We have had challenges making sure we get our numbers together and we can share them, but that's our goal. We make decisions based upon the data. We welcome all the public oversight in the world to come and take a look at what we're doing because we're making the best decisions we can with the data that we have. Government's risk adverse, right? We don't want to accept the opportunity to fail. What Agile gives us is the opportunity to fail early. Every sprint, we have the opportunity to fail and learn from those failures and make improvements. We're not waiting on a big bang implementation 2 years from now to fail. We're going to fail every month. We're going to make 90% of our successes and 10% of our failures, and we're going to learn from them. We're going to keep getting better. But we do it in such a way that we can make changes as a result. Our contracts, we build procurements that generally tend to be firm fixed price, right? On large projects, we don't tend to do time and materials. We transfer the risk to the vendor, and then we want to hold them accountable. Agile is not about holding a vendor accountable, it's about collaborating, right? We want to make sure that we're good stewards of public dollars, but we have to make sure that if our needs change, then we are accountable to the change and the cost of the change, and that the value of the change is important. In the private sector, Agile projects tend to run against ROI. And the way they make the decision is they will say, we will keep taking from the product backlog and keep implementing stuff as long as the cost to implement the next sprint delivers more value than it costs. Well, we measure value a little bit differently, right? We are not in a profit motive. We are in a service delivery, a beneficiary service delivery. So as long as we continue to improve healthcare outcomes, as long as providers continue to get paid timely, as long as we pay them more timely, as long as we get the right data that we need, we're continuing to drive that. And then we have the conversation with legislature and with our oversight agencies about the value we're delivering. And finally, our budgeting process takes a number of years. Agile sprints take months. So when change occurs, we have to make sure that we have a process that allows for those changes. This is something we continue to work with, continue to struggle with, but it's one of the things that you have to deal with. There is hope, I swear there's hope. We have now, through Nilay and Latrenda's leadership, implemented 2 components of our first release, the single sign-on function, and we're working towards the CHDP. We had not made that progress under the old process. We were stuck in analysis paralysis looking at 10,000 requirements and trying to figure out how to not rebuild the existing system with new technology. So there is absolutely hope. You've got to break it down into manageable pieces, you've got to prioritize it, and you have to keep working. What we are doing here, the federal government has already said, I think circa 2011, this is the model for federal procurements, right? Firm fixed price developments tend to create situations where neither the government nor the contractor has the flexibility needed to make adjustments as they learn more about what is feasible and affordable, as well as what needs to be done to achieve a design that meets requirements during a product's design and testing phases. So if the federal government, who arguably is more bureaucratic than we are, at least we'd like to think that, has already seen the writing on the wall and has already moved in this direction, we should be able to too. It's about breaking this stuff down. And I know that our oversight folks want to do the same thing. They want to take large monolithic projects and break them down into more sizable, manageable chunks. And that's the right thing for us all to do. Let's talk about not doing huge projects. Let's talk about increasing success by breaking this down into manageable projects. So I will argue that everything about our current waterfall process, while designed to eliminate uncertainty, does not do that. Instead, what it does is it makes you complacent with the story that you are telling yourself. It makes you think that you have the answers when in fact you don't. And while this may be successful on small projects, it creates a large and exponentially increasing sense of false security on large projects. Large projects are complicated. When we look at the large projects in the state of California, what we see is invariably they replan multiple times. What that means is what they set out to achieve and what they need to achieve probably aren't in alignment, either from a scope, cost, or schedule perspective. Probably numerous ones. But up until the point where they do the replanning, they're running along saying everything's fine. And it's not. So instead, let's be realistic and let's talk about what we're trying to actually achieve and recognize that it is impossible to have certainty on large projects. We are not building a classroom. There are millions of classrooms in the United States, and they all look very similar. They all have the same design constraints. We're building a Medicaid system. There are exactly 50 of them. We are the largest by a huge order of magnitude. There are exactly none that look like ours. So to think that we can plan out every last detail of a system that doesn't exist is impossible. Construction project management is successful because they have built a process by which they can break this stuff down into widgets that are repeatable, that are demonstrated on every project they have done before, because there are very specific design considerations about construction, right? Medicaid is not a street. It's not a road. It's not a bridge. It's not a classroom. And as a result, the ability for us to plan it down to that level of detail is simply non-existent. So Agile helps us create transparency and expose risk, and it tells us that we need to express the uncertainty involved and be willing to live with that uncertainty because it's reality. How many more do I have? Because I know you're up next. So the last one here, I think that is mine, is, and I think I've said probably all of us already, we have the ability to make these changes. We have the business case in front of us. We're demonstrating the success. Other projects are demonstrating the success. We simply have to be open, be transparent, talk about the reality of large-scale strategic planning, small-scale tactical planning, breaking projects down into manageable chunks, and making changes one sprint at a time. And with that, I'll have Nilay come back up. Hope I haven't taken too much of your time.
So from a risk perspective, where does the risk lie? Right? With Waterfall, we see as we will deliver the functionality all at once towards the end, the risk will steadily accumulate and build to a very significant amount of risk towards the end of the project. With Agile, as we talked about, with the working software that we incrementally deliver, driven by business value, that risk is dispersed throughout the life cycle of the project. And as those risks surface earlier, we have the opportunity to address those, learn from them, implement the appropriate mitigation, corrective action, so that it doesn't continue to hurt us going forward. This is an interesting slide, just some common Agile myths that are out there. There's no planning. There's no predictability. We talked about planning and a very extensive planning process when it comes to Agile. As it relates to us, when we saw the release, the 5 releases that we have, the monthly sprints that we have, planning occurs at the overall release level. Planning occurs at the individual sprint level. You know, as Peter said, we don't have the entire view of what we're doing, but to the best, as far as all the data that we have in front of us, the planning occurs appropriately. Chaos. Folks think that Agile is just is chaotic. A bunch of team members running around trying to get something put together. It's very structured, right? We saw through that Scrum, the Agile Scrum framework, there's a lot of structure that we have within Agile. It is not a silver bullet, right? We had gone through the pain previously under the old methodology and the previous implementation approach. Our shift to Agile was by no means a simple change. Anything and everything from organizational change to cultural change to just behavioral change. And obviously, Peter, you know, talked about the training and all of the different aspects on that. It's a continuous challenging process, but the continuous improvement that we have in front of us allows us to get better as we go. No documentation. We talked about the emphasis on working software, but the balance of having the appropriate documentation to support that working software. Agile is not easy, in the interest of time. Agile implementations are more expensive. I would argue the other way. If you go back to this risk slide, the accumulation of risk towards the end of a project on a waterfall and the accumulation in the amount of potential rework in Waterfall as opposed to Agile and surfacing those issues and challenges sooner rather than later, I think speaks to the expensiveness of Waterfall versus Agile. Agile is not scalable. As Peter indicated, largest Medicaid project in the country. We may not have, should not have picked this as the initial Agile implementation, but we're doing it, and it's working, right? So it is certainly scalable. Cowboy coding with no best practices, not the case. In order to be successful, and if that was the case, and this is applicable to Waterfall too. It requires a very structured, disciplined approach to software development. Agile, you have a lot more teams working in parallel and together, and so that requires an extra level of discipline and support.
We've been killed for time.
Killed for time.
So I'm told that we will have to answer questions outside of the room because the next speakers are going to be making their way into the room. So we'll head down to the lobby, and if anyone wants to come and chat with us afterwards, we'll hang out there and answer questions as long as you have questions. Thank you, and sorry for running over.